Everyone knows someone who gardens, but are they wearing gloves? Gardening without gloves is very dangerous and is one of the many ways a person can get botulism. Do you also know anyone who does home canning? Well, home canning is just another way for microbial organisms to germinate and reproduce, creating spores that you may ingest without being able to detect a change in taste, making botulism one of the most dangerous illnesses to contract to date. Botulism has approximately affected over 100 people every year, but now the cases are rising. Here in the Caribbean, there are over 1,000 cases reported this year, and they are seemingly increasing. Now, do you need to panic and buy all the toilet paper? Of course not, but there are a few things you need to know about the disease to ensure your family is safe and protected. Botulism was a rare illness that is caused by neurotoxic spores that attacks the nervous system. Clostridium botulinum, the bacteria that causes botulism, is an anaerobic, rod-shaped gram-positive bacilli. This means the bacteria is able to germinate even in the absence of oxygen. Since there are 8 strains of Clostridium botulinum, it is more likely for it to be a widespread outbreak. These strains are categorized from A to H, and each strain produces a different toxin. Only types A, B, E, and F are toxin within humans, while other toxins are toxic to mammals. Based on the CDC's overview report, botulin type A has been the most common type to infect humans.
Botulism. How is it transmitted? The bacteria exists as spores that can be found in the soil, mud, and bodies of water, like rivers. It can also be ingested, usually from poorly processed and pressurized canned foods. So the bacteria is able to live and produce spores that can be ingested without detection, since it has no odor nor taste. So do be careful of food products that you are purchasing or making and fermenting in your homes if you do not have the proper tools to preserve your goods, especially since these spores are resistant to heat, light, and radiation. Clostridium botulinum can form spores at room temperatures from 25 degrees to 37 degrees Celsius, and also in very acidic solution. These spores can also be inhaled and can multiply and infect open wounds. Symptoms of botulism may vary from mild to life-threatening, depending on the type of infection. And these range from vomiting, diarrhea, weak muscles, difficulty with sight, to causing respiratory muscle paralysis or symmetric paralysis of motor and autonomic nerves, starting with the cranial nerves. Symmetric descending paralysis of motor and autonomic nerves occur, meaning it occurs on both sides of the body, starting from the head to the rest of the body. This happens because the toxin produced from the Clostridium botulinum binds to the presynaptic neuron, blocking acetylcholine from binding to its receptors on the muscles, preventing contractions to occur. The toxin also prevents snare protein from releasing the acetylcholine by destroying it so it cannot be released from the presynaptic neuron, making this one of the deadliest toxins in the world. There are 4 ways in which this infection can occur. And the first one being discussed is foodborne botulism. This is the second most common way of infection. Persons experience abdominal pain or cramping from this type of botulism. It can also lead to intestinal botulism, since the spores are able to germinate within lining of the intestines. These who have contracted foodborne botulism also experience diplopia, which is when you're seeing double. Some persons also display droopy eyelids and mydriasis, the dilation of the pupil. Foods that contain bacteria are usually from homemade canned goods that have been poorly preserved or fermented. Based on the epidemiology overview report from the Disease Central and Prevention Center, there is an average of 110 reported cases annually in the US, and about 25% are foodborne botulism. Infant botulism is also known as floppy baby syndrome, since the neurotoxin affects the muscle tone. Infant botulism is caused by ingesting botulinum spores that multiply in the intestinal tract, releasing its toxin. This type of botulism is linked to eating honey, and it is said that honey affects the intestines of infants because they have not yet developed mature intestinal flora. Some symptoms to look for in infants are constipation, a weak cry, and poor muscle definition.
Infant botulism is the most common type of botulism, and as you can see in the data shown above, there were 141 cases reported in 2017.
Womb botulism is just like its name. You can get botulism from having an open womb and spores enter. So if you're gardening and possibly cut yourself and you don't treat the wound, it is possible that soil containing botulinum spores can enter your wound and become infected. Wound botulism is also highly occurring in persons who use injection drugs, mainly in black tar heroin users. It is still unknown as to why this type of heroin is usually associated with the bacterium. After contamination, a person may experience leukocytosis, which is high white blood count that indicates infections and inflammation is occurring in the body. There will be no gastrointestinal symptoms like foodborne and infant botulism.
As stated by Kirk M. Chan-tak, the mortality rate of foodborne botulism is about 5 to 10%, while wound botulism carries a mortality rate that ranges from 15 to 17%.
How can botulism be treated? As stated by the CDC, prompt diagnosis and early treatment of botulism are essential to minimize the otherwise great risk of death. Knowing the signs and symptoms are pertinent to getting quick treatment. Detecting the toxin can allow for doctors to provide patients with an antitoxin to slow down and stop any more damage from being done to the neurons. Also, a Clostridium botulinum toxoid can also be given, so it binds to the toxin, preventing it from binding to the presynaptic nerves. Botulism is rapidly taking over the Caribbean. People are experiencing extreme conditions and symptoms. To ensure you and your family are safe, remember to not garden without gloves. Be wary of home canned foods and do not give infants honey or corn syrup.